Yeah, my subscribers, welcome to my YouTube channel. This is Dr. Chitu Jamil, as usual. Those ones who subscribed, thank you very much for the subscription. And those ones who have not subscribed yet, subscribe, put on a notification, and we continue to learn. I'd like to send my greetings to all those subscribers who are in diaspora, subscribers from Dubai, from Qatar, from Jordan, from USA, from Uganda, everywhere you are. I convey my greetings to you. Today, we are going to look at a very important topic as concerning our health, concerning our day-to-day life, concerning our lives. Many people are there, I have a lot of questions about the various types of family planning we use. They are wondering what is the best family planning method to use, and when I'm on this family planning method, how does it work when it is in my body? We are going to be looking at these methods one by one. Today, we are going to begin with intrauterine device, call it an IUD. This device is inserted in your uterus, and it can work up to 10 years when you are not conceiving. They are of two types. One type is a copper coated intrauterine device, and the second one is a progestin releasing device. We insert them in our uterus, and they can help us to avoid conception, to avoid having unwanted pregnancies. To begin with, what are the benefits of using such a method, or of using the copper-coated intrauterine device among other methods? One, it can work for over 10 years. Two, it can be removed at any time you want. At any time you feel you're tired of using it, it can be removed there and then. Three, you are not going to have pregnancies that you don't want, and you will not have to interrupt your sex because of fearing to conceive. You will have to go and have your sex as normally, the normal way you have been having your sex, minus thinking of things or getting pregnant. Then we're going to look at the contraindications. Which group of people are not supposed to be given, or should not use, or we don't recommend to use this type of devices? One, the first group are those people who have what we call cervical cancer. People who have what we call uterine cancer. People who have abnormal uterine. They have uterine deformities. They have fibroids. They have variant cysts, which are non-functional cysts. People who have thick endometrium, we don't recommend them to use such a type of device. And people who have conditions like Wilson's disease, these conditions lead to accumulation of excess copper in the vital organs like the brain, the heart, the liver, and they expose the patient to that toxicity of that iron. So we don't recommend them to use these devices. After there, we're going to look at the common side effects of this device. Beginning with a copper-coated intrauterine device. How does this one work? A copper-coated device is inserted. It's a device as you see it, T-shaped, but with a copper wire coated outside. When it is inserted in your uterus, it is going to cause a local inflammation inside your uterus. And this inflammation it is going to cause is going to release toxins. And these toxins are going to be very lethal to the sperms and your female eggs, the ovum. So once an ovum is produced, these toxins can go on and kill it. If the sperm enters the uterus, these toxins can go on and kill this sperm. So it works by inflammation, which produces toxins, which toxins are going to do what? Are going to go and kill your sperms. So once the sperms are killed or the ovum is killed, you are not going to conceive. And this one can happen up to 10 years. Copper-coated uterine device can prevent you from getting pregnant or can protect you from having unwanted pregnancies and conceiving when you are not ready to conceive. You will only conceive when you reach the time and you want to get a baby. Then you go to the health center, they remove this device, then you go on and conceive and have babies as you want. So it's very good. It is one of the safest methods we recommend people to use because it is highly tolerable with minor side effects. So among all family planning methods, the copper-coated intrauterine device is the best one. We mostly recommend people to use because of its limited side effects. The common side effects, and one of the risk factor and the commonest side effects of this device is what we call ectopic pregnancy. Because once this device is present in your uterus, there will be no implantation. Even if the sperm escapes and goes and meets the egg, they fertilize, you're not going to have implantation within the uterus. What is going to happen? This fertilized ovum is going to implant itself in the fallopian tubes, uterine tubes, which we call ectopic pregnancy. So once see signs of being pregnant, you should consult your health practitioners as soon as possible. And if it is ectopic pregnancy, they remove it as soon as possible because it can lead to death. Rupture of these tubes, it can make you bleed and lead you death. 2. Have severe menstrual pain and heavy bleeding. Another associated side effect is bleeding between your period. Having abnormal bleed, you can bleed at the time where you're not expecting to bleed, and you see blood coming out. And another thing you should note while using these devices is that they don't protect you from getting sexually transmitted disease. I repeat, when you are using this device, it is not going to protect you from contracting a sexually transmitted disease, even HIV/AIDS. So you should always have safe sex, not just going to have the sex because you're having a uterine device, you think it's going to protect you from such infections. No way. Always have safe sex. Expulsion of the device from the uterus. Some people, in some cases, they get their devices expelled out of the uterus and they fall. You just feel it within the vagina. What brings this? When someone has history of expelling a device, they expel the device in the first place. Then when you're starting the second one or the third one, there are higher chances that this person is going to also to expel this device. 2. Inserting the device when someone has just given birth. There are at a higher chance of expelling this device. 3. People who normally have very, very painful menstrual periods, they are at higher chances of expelling these devices. Another category are the people who have never given birth. They have never given birth, they have never aborted. So they also have higher chances of expelling these devices. Another category of people, they are people below 25 years of age. If you insert a device in these people who are below 25 years of age, they are at higher chances of expelling these devices and they fall out of their uterus. Preparations when you're going to your doctor to insert this device. What is the doctor? What do you should expect from your doctor is that they are going to do what we call UTI screening. They are going to screen you for anything like a urinary tract infection before inserting this device. 2, they are going to do a pelvic exam before inserting this tube. For people who have just given birth, your doctor, your specialist is going to give you 8 weeks before they insert this device. So, looking at the second set of our intrauterine devices, we're going to look at the Mirena type, which is a progestin releasing device. Once this device is inserted there, they are of the same shape and size. The only difference, the first one, a copper wire is coated on the devices. The second one is going to be releasing a hormone called progestin. When this hormone progestin is produced, it is going to go to your mucus circulating cells in the uterus and make them to produce very, very thick mucus. On top of that, you're going to stimulate the cells to thin the uterine lining. So your uterine lining is going to be very thin, so that even if the egg is fertilized, it has nowhere it's going to be implanted. So, what is the essence of the thick mucus? The thick mucus that is going to be produced is going to slow down the movement of the sperms, the swimming of the sperms, as they are continuing to your uterine tubes to find the egg for fertilization. So the thick mucus is going to trap all the sperms the man is going to deposit in you. The man is going to be depositing the sperms into the lady, but this thick mucus is going to be arresting all the sperms like this. They will have nowhere to cross to go and fertilize the eggs. Common side effects have breast tenderness. Since it is a hormone releasing intrauterine device, we're going to have breast tenderness. We're going to have mood changes, severe menstrual bleeding, severe menstrual pain, among others. So you should always go for others contraindication indications. They are same the first one we looked at.